I'm Professor Hugh Grant, and this is the School of Public Policy. Today I was pleased to release a report on physician incomes in Canada. We looked at physician incomes over time to determine their overall impact on total healthcare budgets. What we found was that in terms of constant dollars, physician incomes have increased quite rapidly, particularly over the last 10 to 15 years. I think the remarkable part in the last little while has been that what's driven the growth in incomes has been a rise in fees per service and not the overall level of service itself. That's quite a contrast to a period of 10, 20, 30 years ago when it was rising services that was driving the increase in incomes. Here's why I think that has occurred. I think there's been a constant battleground between government groups and physician organizations over the number of physicians in the country and the overall level of physician services. Both groups appeal to the public for support. I think the increase in waiting lists, the shortage of physicians in rural areas, so-called hallway medicine, I think all of that occurred sort of 10 years ago or so really influenced the public mind and gave physician organizations sort of more control or greater bargaining power at the table. I think that's all changed, and I think the pendulum's swinging back again. And so I think we'll really expect to see governments bargaining much harder on fees over the next little while. In the 1990s, there was real concern over brain drain, about Canadian physicians going to the United States for more lucrative positions. All of that's really changed. HMOs in the United States really have changed a lot of their rules that have restricted the access of Canadian physicians to employment there. At the same time, the Canadian dollar's reversed quite a great deal. And so the difference in income isn't as sharp as it used to be, and the opportunities there are simply less. This issue matters because of the impact of physician services, and particularly physician incomes, on the overall healthcare budgets. And they do that in two ways. One is directly for paying for physician services, but secondly, the fact that it's through your primary care physician that you get access to other resources like prescription drugs and hospitalization and such. And so physicians have always been and will continue to be a focus of cost containment in the Canadian healthcare system. I predict there'll be a growing era of conflict between governments and physician organizations, both in negotiations of the fee schedule and sort of the traditional approach that we've had, but also I think there's a larger concern about overall healthcare reform and to the extent to which physician organizations have to be more flexible in allowing different types and processes of delivering primary health care. I think this is an issue that physician organizations have to take very seriously because if they want to maintain their professional autonomy, in a sense that they've been delegated the task of providing health care services and physician services in an affordable means that they can both be well remunerated and yet there's an adequate level of service to Canadians. I think they have to take that seriously, and then they look at a situation where costs seem to be getting out of control, then they have to react responsibly. If they don't respond accordingly, they simply do invite all forms of government encroachment into their professional autonomy. That can range from governments negotiating over specific aspects of the fee structure, trying to look at the incomes of specific groups of physicians, and much more, in a much more threatening way, changing in scope of practice rules that allow physicians essential monopoly over the delivery of certain healthcare procedures. I'm Professor Hugh Grant. This is the School of Public Policy. Thank you for watching.